We'll get started. Hello and welcome to today's SEAside webinar. My name is April Wright and I am the All of Us Community Engagement Coordinator for the Southeastern Atlantic region. Before we begin with today's speaker, there are a few administrative things that I'd like to cover. Closed captioning is available on the link that's noted here, and it is also in the chat box. If you are sharing, or communicating, asking questions in the chat box, please be sure to send it to all attendees or all participants, so that I, our guest presenter, and your colleagues can see your questions and information shared. And our presenter, Dana Ladd, will answer questions at the end of her presentation. Okay, Dana Ladd, PhD, has over 19 years of experience as a librarian. Dr. Ladd began working in the public library environment, where she became interested in consumer health after managing the consumer health collection development responsibilities in the library's Cancer Center website. She is currently an associate professor on the faculty at the Tompkins-McCaw Library for the Health Sciences and is the Community Health Education Center librarian. At the Community Health Education Center, Dr. Ladd manages the daily operations of the library, supervises and trains staff, provides consumer health information services for patients, their family members, and the public, and teaches health information classes. She also plans and coordinates health and wellness events and presentations and coordinates the center's participation in local and community health fairs. Dr. Ladd earned her doctorate degree in social and behavioral science from Virginia Commonwealth University School of Medicine. Her dissertation focused on the information needs and information sources of patients diagnosed with rare cancers. She received her MS in Information Science from the University of Tennessee and specialist degree in Library and Information Science from the University of South Carolina, where she specialized in health sciences and consumer health information. Ladd has an extensive record of scholarship and most notably co-authored a Medical Library Association Guide to Diabetes Information and Resources. The book received a Library Journal starred review. She also authored several journal articles and a book chapter titled What Patients Need to Know: Information Needs and Sources of Patients with Rare Cancer in the Textbook of Uncommon Cancer. She has presented at state, regional, and national library conferences. Please join me in welcoming Dana Ladd.
Thank you so much, April, for the introduction, and thank you all for attending the presentation today, where I'm going to describe a project that VCU Libraries has been working on called Collaborative for Health Literacy, Log On for Health. And to begin with, I'll just give a brief overview of what and background, and then talk to you a little bit about the development of the classes and workshops that we did, and then talk a little bit about some of the feedback we've received and the next steps of the project. And at the end, as April said, I will take any questions that you have. So just for introduction, our project was is a partnership of the Virginia Commonwealth University, Tompkins-McCaw Library for the Health Sciences, the Community Health Education Center at VCU and VCU Health, and the VCU Center on Health Disparities. And this is our project team. And the person on the far left is Elisa Brewer. And Elisa works for VCU Center on Health Disparities. And she is the Director of Community Engagement. And Emily Hurst, pictured in the middle, works for VCU Library. She's the Tompkins-McCaw Library Deputy Director. And I am Dana Ladd, and I am the Community Health Education Center librarian, and I actually work for the Tompkins-McCaw Library for the Health Sciences. And just a little bit about the VCU Center on Health Disparities. It was established in 2005, and their main goal is to develop the capacity of faculty, staff, and students and community partners in the Richmond area to identify the causes of and develop interventions to eliminate health disparities. And one portion of that, they focus a lot on research, but a lot of focus is on community engagement and building partnerships within VCU, then Richmond, and then in the community. And the Community Health Education Center here at VCU is a library for patients, their family members, and the community. Basically, anyone who is looking for health information can come to the library. It's located at VCU Health in one of the busy outpatient buildings. And we have trained staff. I'm here full-time as the medical librarian. We have an assistant who helps out and a team of dedicated and trained volunteers. And in addition to providing health information services in the center, and I'm going to refer to the Community Health Education Center as CHEC. We also do a lot of outreach within the community, within the hospital and out in the community. We do health and wellness programs each month within the library, and we do guided meditation sessions in there, and different stress relief programs, and different programs on different diseases and conditions as well. And so back in 2014, the Center for Health Disparities received a grant to do a project called the Preterm Birth Prevention Project. And they asked CHEC to participate in this project by evaluating some materials they had developed. They had created educational materials for program participants to teach them about healthy pregnancies and things they can do to be healthy, that the mothers, it was aimed at the mothers and the fathers of the children. And so we became part of this project and helped them evaluate the materials. And one component of that was consumer health materials. So they were showing these over at the resource centers in several of the housing projects in the city's East End. So as a part of that, what we did, we decided to also do some programming here at CHEC for participants in the Preterm Birth Prevention Project. So we did a tour, we gave a tour of CHEC to the participants and an overview of the resources that we have here at the library that would also be available for them. And in the evaluations that we received, and when talking to a lot of the participants in this project, we found that there was a need, they requested a need for more computer education, more information on patient-provider communication, so how they can communicate better with their providers. And they also requested a need for more information on finding reliable online health information. So based on that, in order to address the needs that we discovered during the Preterm Birth Prevention Project, we decided to develop a health information literacy workshop to address those needs and to fill that gap. So we worked with Elisa with the Center, through the Center on Health Disparities to develop and conduct a series of health literacy and technology classes. And so we wanted it to be not only health information, but also classes that where they can practice using the computer as well, so we could also fill that gap that they needed on learning more computer information. And just to give you a little bit of background, because we're located in Richmond, Virginia, so I know probably a lot of you are watching from different areas that may not be familiar. So I wanted to show this map. So the best place, so VCU and the library that we're located is near the dot that says Richmond Coliseum. So we're located right there. And then this area that looks almost like a question mark in red is the city's east end. And also the Churchill area is a part of that as well. So I just wanted to show that so those of you who aren't familiar with the area would know. And just a little more description of the city's east end. It's an urban community. There are approximately 27,000 residents in the area. It is historically African American, and it's a low-income area, and it is a food and resource desert. There is a high prevalence of obesity, diabetes, high blood pressure, and asthma in the area. So once we developed the idea, we decided to apply for funding, and we applied for a National Network of Libraries of Medicine Health Information Outreach Award, and we were awarded $15,000. So with that, we purchased 9 laptops. So we wanted each of the participants to be able to use a laptop at the workshops. And we were only able to purchase 9, so sometimes people had to share, and so far that hasn't been a problem. And we also ordered a mobile laptop storage unit just to make it a little easier. We house these at the Center for Health Disparities, and someone brings the mobile laptop unit with them. So, and we're able to use that too as a charging station to charge all of the laptops at once. So it's been very convenient to have that. We also used the funding to towards some personnel costs and for travel costs. So for us to travel between VCU and over to the East End. And then also Elisa with through the Center on Health Disparities, she also is able to pick up some of the participants if they arrange that with her in advance. So that makes it easier for a lot of our participants to attend. And we also purchased incentives for participants, and these will be used for, in about 2 more weeks, we will be conducting focus groups. So any of the participants who attend the focus groups will receive a $20 gift card for attending and giving their input. And then also indirect costs to VCU. And originally, we had planned to conduct these workshops at a new wellness center that VCU is opening in the East End. But there were a lot of delays, a lot because of weather and a host of other reasons. They've delayed opening that center, so we had to find another place in the East End to conduct our health literacy workshops. So I had worked with the public library branch manager at the Richmond East End Library, and had about 2 years ago, or about a year ago, had conducted training sessions for Richmond public librarians at each of, I believe there were 10 branches of that system, and we had developed a relationship with the branch manager at the East End Library. So we asked him if we could hold our sessions at his library. So he was very agreeable to have us hold those there. And he's been great to work with and helps us set up the room and get everything ready. And that has also, and as I'll talk about in a few minutes, has helped us promote these workshops as well to the residents of the city's East End. So we decided to develop 6 workshops. So we planned, Elisa, Emily, and I sat down together and decided on 6 different topics. And the first one that we did was on understanding health insurance. And we invited a speaker for this one, an outside speaker from the Virginia Poverty Law Center. And we had her talk about the health insurance marketplace and common terms used in health insurance. And also she demonstrated some online eligibility and coverage websites. And in that class, we even had one of the participants was able to sign up and receive, he was able to get coverage for health insurance. Our second class was on finding and evaluating consumer health information. And so in this class, I was the speaker for this class and went over the importance of evaluating health information when people go online. I talked about evaluation criteria that they could use when they do go to Google and look for health information. And then for the majority of the class, I demonstrated several reliable consumer health websites, particularly medlineplus.gov. So I showed them how to access medlineplus.gov, how to search for health information, and then how to search for drug information on the site, and also how to search for information on prescription drugs. And then I showed them how to find low literacy information on the site as well. And the third class was on the patient portal and electronic medical records. For this class, we had someone from VCU Health who works heavily with the hospital's patient portal come out and talk about how to access or sign up for the patient portal at VCU Health, and then how to access their electronic medical records as well. And then she also made it generic enough that if they weren't a patient here at VCU Health, maybe they were a patient somewhere else that used a different portal, she gave them some tips on using the portal in general. Our fourth class was taught by Emily Hurst, and it was on using mobile health apps. And Emily talked about how to evaluate health apps and how to identify some reliable health apps and how to sign up to use them, and also demonstrated several health apps to the audience. Our fifth program was on food and nutrition and healthy eating. So for this program, I had met a speaker back a few years ago who teaches over at J. Sargent Reynolds Community College, and we asked him to talk to the group on nutrition. So he went over some terms that are used to have them be more familiar, and then he also discussed tips on how to eat healthy, and then answered any questions that they had about things that they may eat. And then lastly, our last class in the series was held yesterday on senior health. And this class was taught by the community outreach specialist for Senior Navigator, also called Virginia Navigator. So we brought her in to talk about issues that pertain to seniors, but also to demonstrate an online website that's used here in Virginia specifically, called Senior Navigator. So it's an online directory for health and local resources. So she demoed that as well, and then answered any questions that participants had about Senior Navigator or different health issues for seniors. So those were the 6 classes. And the structure was, so we started the classes at 11:30 in the morning, and we had an optional class at 11:30 until 12, which was a computer basics class. So we found some computer basics modules and loaded those on the laptops, and then so those cover different things such as using the mouse, ergonomics, and different computer basics issues. For anyone who felt uncomfortable using the computer, this was a great opportunity for them to practice and get some help. And we had, so Emily and Elisa and I were there, and we also had several students or interns helping. So a lot of the times And if you could see in the picture, some of the students would sit with the participants in the class and help them individually as well. So there was a lot of opportunities for the participants, and they could ask questions as well if they had any questions about using the computer. So after the computer basics class, we had lunches, box lunches for everyone. So we invited them to go up and get their box lunch, and while they were doing that, we would set up for the speakers on the 6 topics that we had, and then the speaker would come up and present on one of those 6 topics. And then ask at the end if there were any questions. And then at the end of the speaker presentation, I would give an overview of Medline Plus, and then an overview of how to find more information on that relevant topic. So, for example, yesterday was the class on senior health. So after our speaker from Senior Navigator presented information, I came up and gave an overview of Medline Plus, but also talked about how they can find more information on senior health through using Medline Plus. And then asked if there were any questions. And then at 1 o'clock, the participants in the class were invited to stay longer. We would stay until 1:30 and help them with any other questions they had about the topic or with using the computer. And it just gave the participants an extra chance to practice using the computer or ask any questions. And so we had lots of different questions asked at those. We had during flu season, someone asked about where can I go to get a free flu shot? So it was almost a time, for reference questions. And yesterday, someone asked about taking a class somewhere locally. And so it's just extra time for them to ask questions and practice on the computer, and we can help them as well. And then I invite them to, at the end of class, if they had any other questions, then they can contact us at the Community Health Education Center. And what's really interesting is that we had several of the attendees in this class actually come by the Community Health Education Center here at the library and ask additional questions as well. So we had lots of advertisement go out on the classes. As said earlier, we had student interns working with us, so they developed for each of the classes. We developed this template, and then they would fill in the information for the descriptions for each of the classes, and they would send those out. We would print out flyers and post them in the library here at the Community Health Education Center. And it would go out through social media, through the Center on Health Disparities, social media, and then the Community Health Education Center's Facebook page and web page. And then we also sent them out to our partner networks as well, the Reed Center, which is a Center for Literacy, through the different branches of the Richmond Public Library, different local coalitions, and then also at the different housing centers, the area housing projects as well, to their network centers. So our current status, so we began these classes at the East End Branch Library in November 2018. And like I said, we finished our last in a series of 6 yesterday. And we had really good attendance at these. So at our Understanding Health Insurance, we had 8 people attend. For Finding Consumer Health Information, we had 10 attendees. For the Medical Records class, we had 10 attendees. And Finding Health and Wellness mobile app, 10. For the Nutrition class, we had 3. And Senior Health, yesterday, we had 11 attendees. I must say for the nutrition class, I think the reason for the drop in attendance is we had a lot of people signed up for the class, and then last minute a lot of them either contacted Elisa to cancel. That was during the time, I think, the flu was raging here in Virginia. A lot of people were sick and unable to attend. So I think more would have attended that if they had been well. And this is the information from the evaluations that we gave out during the class. So this is an aggregate of all of the evaluations from the classes except the last class on senior health. I haven't received that back yet. So most of the people, or all of the people, said that they that the training introduced them to at least one health information resource they had never used before. All of them said yes to, did you learn a new skill that you plan to use in the future? 97% said, did you improve your, did they improve their ability to apply a resource they already used? And for all of these, they either strongly agreed or somewhat agreed to this training improved my ability to find useful online health information. They plan to start using at least one resource or tool that they learned about, and they plan to tell others about at least one resource or tool they learned about. And we broke down the qualitative data into 3 different categories to the question, how will you use what you have learned? And personal, social, and professional use. And a lot of them said that they would use the information to learn more about their condition and to get help with medicines. And they said also to look up the side effects of medicines that they're on. One specifically even talked about using Medline Plus to find more accurate information. And I think the looking at or evaluating the websites really hit home. One also wrote that they learned how to avoid false websites. And a lot of them, 3 had talked about how they would use these to practice. And they were also going to tell other people about these resources as well. So our next steps, like I talked about a little earlier, we will be conducting a focus group on April the 23rd to get more feedback from the participants of these classes on what they learned and what they would like us to do better and what they would like to see in the future. And also I talked a little bit earlier about how we had initially planned to hold these sessions at the VCU Health Hub, and we were expecting them to open in January, but now they're not expecting to open until May 2019. So we would like to begin these workshops at VCU's Health Hub starting in the fall 2019. So we're going to use the feedback that we receive from the focus groups and the evaluations to improve upon these classes. And now that we've done 6 of them, we kind of know what to expect for them. So we feel like these will go really well. So we're going to start back up. We may add a few new classes as well. One of the classes that someone had expressed interest in was us having a class on smoking cessation. So we might add that as well. So it'll be our 7th class. And I'll talk to you a little bit about the Health Hub. So it's the Virginia Commonwealth University Health Hub is an education and wellness center. It's going to be located in the city's East End at the corner of 9 Mile Road and 25th Street. And on it, there is going to be a grocery store there. So like I said earlier, the city's East End is a food desert. So this will be a nice-sized grocery store where residents will have access to healthy options. And then attached to the grocery store is going to be a 5,600 square foot facility. And there will be health screening and consultation spaces there. And VCU health providers and students will provide behavioral health support, grief counseling, nutrition counseling, exercise classes. And there will be a community room there, and that's where we'll be doing our health and wellness presentations there. And there's also going to be a small health education resource center at this facility. And I put a picture there. I looked over there yesterday when I was in the city of East Bend. They've come along even more. So the building in the foreground in the red is actually going to be a culinary institute. And behind that is going to be the health hub and the grocery store. And I believe the two-story building in the gray is that big area there is going to be the grocery store. And then next to that on the first floor is the 5,600 square foot health hub. And then above that, I believe, will be apartment buildings as well. And so they actually, I noticed yesterday, put the signage up. And so it's come along nicely since this picture was taken. And then there's more pictures of the health hub close up, as you can see the apartments and then the health hub on the bottom. And then some interior pictures of the health hub. And this is the reception area, and then these will be the areas where they'll be doing the different consultations with visitors to come in, the different behavioral health screenings or nutrition counseling, and the classes. And so lastly, I was going to ask you if you had any questions that I could answer about our health literacy programs in the East End. Okay, so asked, did you find that the computer training was needed? We did, yeah. A lot of people attended the optional computer basics training classes, and we had to help a lot of them individually. So even as what simple things as using the mouse, a lot of people had trouble with using the mouse. So we were able to demonstrate how to do that and work with a lot of them individually to teach them how to do that. And then a lot of them, so using the mouse, and then also we had a mouse and the laptop had the little touch pad as well, so we taught them how to do that. A lot of them had never used that. And then just even like a lot of just using the keyboard and keyboard basics. And then also we would sit with a lot of them after the class too, and they had computer questions as well, even after the class. And one of the great things about working with the Richmond Public Library is they also would come in and talk to the participants about different computer training, computer workshops that they had coming up as well. So there were other opportunities too for them to receive computer training. Yeah, thank you. Any other questions? So the next question is, were the audience members a range of ages? So I would say mostly, I would say they were seniors, but there were a range of ages. I did notice, even on one of the feedback form from yesterday, someone had written on there that she is 17. So there were definitely a range of ages, but I think most of them are probably 50 and older. Any other questions?
Do participants get any sort of certification for participating in the class? That was one of the questions that came through.
Oh, okay. No, actually there isn't any certification that they received. But that's a good idea maybe for the future to maybe have something like that set up. Okay, so we have another question. Did attendees attend multiple sessions, or was it mostly a new crowd every time? So we had a lot of the attendees were regulars, so that they would come back each time, but I did notice a lot of new faces too. So for each session we had some new ones, but we had probably three or four that came to almost all of them. The only one where we really didn't get too many people was the nutrition class. I think so many people were sick. But you know, looking at all of the other classes, you know, we definitely had that core group that would come, and then we had some new faces. And they were really interested. I even had one lady that would come by my library and ask, you know, she wanted to make sure she never missed one, so she would stop by the library and ask me, oh, when's the next one? I want to make sure I come. So I think she made it to almost all of them. And so, yeah, they were really excited about it, the ones that came to all of them. And the next question is, what questions were asked about chronic diseases and or medications? So we had, so for medications, I think the biggest question was side effects of the drugs that they were on. That seemed to be what they were most interested in finding out about medications. And then for chronic diseases, some of them would kind of talk about different diseases they would have. I think a couple of them talked about diabetes, so they asked questions about diabetes and how to get more information about that. So, yeah, that's mainly what they asked about chronic conditions and medications. Thank you. And one of the other questions that we got a lot too wasn't necessarily chronic diseases or medications. I just thought about, a lot of them asked about different resources in the area, different things, more like organizations or resources in the area. And we even had one of the attendees ask about how to, there's a program where you can get, I think, a free cell phone for seniors. So we even had someone ask about that as well. So how could they sign up to get a free cell phone? So one of the students, I believe, helped him with that, to sign up to get a free cell phone. And then I also had a couple of the attendees say that they were going to come by the library as well here over the Community Health Education Center, and that, you know, the next time that they were here for an appointment and come get information as well.
Dana, there's another question.
Oh, okay.
To do any follow-up with the attendees other than a focus group?
So probably what we'll do after the focus group is invite them for this group, if they want to come back and attend the programs that we'll be doing over at the Health Hub at 25th. So I think that probably, even though they've gone through, a lot of them have attended each of these workshops, I think a lot of them probably would like to attend those again. So we'll probably follow up that way and just let them know when those will be, when those are scheduled. So that would give them the option if they want to go through this again, or even if they just wanted to come and do the optional computer basics training, or if they just want to come for the workshops again, the actual presentation. Okay, so we have another question. I missed the beginning because the sound issues. You might have talked about this, but did you do any consumer health workshops for library staff? So we did. So what we did about a year before this program, I had developed a consumer health training workshop for librarians or anyone who was helping people find health information. And we conducted one here at the Community Health Education Center. We invited anyone who wanted to come, and we did sort of an all-day or 1.5-day training session for librarians here. And then after that, we were invited to go to Prince William County, which is I guess, north of Richmond in Virginia. And we did training for librarians, all of their public librarians in that public library system. And then after we did that, we were invited by the Richmond Public Library System, and then we went to all of the public library branches in the area and did about a 45-50-minute library staff training workshop. And basically that involved talking about evaluating health information online, and then I demoed several reliable health websites such as Medline Plus for the library staff. And we hope to resume doing some more of those for public libraries in the area in the future as well. Okay, someone asked will the slides be made available. I think, April, I believe you had said that the slides would be available. Is that correct?
Yes.
Yes. Okay. And if anybody had any questions too, so on the slide I didn't go into a lot of detail about the content of the individual workshops, but if anybody had any questions, feel free to email me about specific content of the 6 different workshops, and I can give you more of the specifics on what was covered in those. I just kind of went over that briefly because I didn't want to overwhelm with all of that, but I'd be happy to let you know more specifically about those. You can just email me. My contact information is at the end of the slide. It's my email address. Okay, so the next question, was there any discussion about behavioral health changes? So not a whole lot about that, but that might be something to incorporate in the future about more of a focus on behavioral health. But yeah, there really wasn't a whole lot on that. Any other questions, comments? Oh, thank you so much. Oh, and then someone asked, is there a survey attached after this program? April, is that something they'll get?
Yes.
Yes. Okay.
All right. Well, thank you very much, Dana.
Oh, well, thank you so much for having me do this. Thank you, everyone, for attending as well.
Yes. So, if anybody has, if you think of any other questions, please just let Dana know. And her contact information is listed here. Today's presentation was recorded, so it will be on the NNLM YouTube website. And that is the link. Let's see. And once the recording is available on YouTube, I'll email everyone who pre-registered for the webinar a link to the recording. And
Hello, April. April?
Hello?
Your audio, oh, okay, it went away. Are you and Dana in the same room because it was echoing really bad?
No.
Okay, she muted, so it's fine now.
Okay. Okay, so thank you. Anyway, so I'll send out a PDF of the slides, and Our next SEA webinar is one of Dana's colleagues, Emily Hurst. There's an app for that, Tips to Evaluate Consumer Apps for Health. And that will be on Wednesday, the 17th, so next Wednesday from 1 to 2 p.m. Eastern Standard Time. And to get your MLA credit, you can go to this website and use the enrollment code LIT0419. And I will send out an evaluation link for this particular webinar. Again, thanks everyone for attending, and thank you, Dana, so much for presenting. And everyone have a great afternoon.
All right, thanks so much, April.
Thank you.
Thank you.